Hi everyone, it's Kim here. Welcome back and thanks so much for being here. Welcome to all the new mums, dads and carers. It's great to have you here. So from the time I first asked parents and carers what information or topics they would like covered, the issue of tongue ties has kept coming up. So I thought it was about time I covered this for you. So as you may know, the issue of tongue tie and lip tie is really controversial, so I won't actually go through the controversy, but I'll actually cover information that shows you what to look for and actually where to go for help and what sort of help you may consider. Okay, so the diagnosis of tongue tie and the assessment of it is actually quite complicated. Okay, so there needs to be a really thorough history of how the baby has fed since birth. There also needs to be an observation feed done in front of the health professional who you choose, and I'll run through who that might be in a little while, and an assessment of the feed and the baby's latch. Also, the baby's growth and development needs to be considered, and the appearance of the tongue and the lip in the mouth, and if there's any restriction there, it also needs to be considered. Okay, the tongue's got a major role in breastfeeding and bottle feeding, also in eating solids, speech, swallowing, and oral development, and also the placement of teeth. So sometimes things that you don't think of. To feed well, the tongue needs to be able to extend beyond the gum line. Okay, it also needs to be able to lift from the base of the mouth, and these two things together actually allow the tongue to be able to lift and extend and go beyond the brown tissue around the nipple where the milk ducts are, and bring the milk out of the breast into the baby's mouth ready to swallow in that wave-like action of my hand. Okay, so if there's any restriction on the tongue or the upper lip, that can actually stop that process from happening. The other thing it does in that action is bring the nipple right to here inside the mouth, which is near the soft palate, which means that there's no friction on the nipple, and there wouldn't be any nipple damage because the baby's tongue is placed near the soft palate in the mouth. So you can actually get damaged nipples when there is a tongue tie and a lip tie, and in other cases there may be no damage to the nipple, so it's not a good indicator to use that as a sole sign. The other thing the baby's tongue needs to be able to do is actually move from side to side. So if there is a restriction in the mouth that stops the baby's tongue from moving, lifting, extending, or the lips from flanging out around the nipple and the areolar tissue, the brown tissue around the nipple in that special K-type mouth, then we need to have it investigated, okay? Or you need to just go and seek some help and information and support, okay? With these restrictions, it actually doesn't allow the baby to latch deeply on the breast. Now, in the first 8 to 12 weeks, this might not be any problem because the milk supply is fairly automatic, but sometimes about 8 to 12 weeks, when it's setting up the supply-demand type of feeding, because the baby's not able to stimulate the breast as much, then the supply can drop off, and that's when we see decreases in weight gains and that sort of thing. Other babies can have that problem from birth, okay? So we do see in the community a difference in presentation, but the history and what we see in feeding tends to be a bit the same, okay? So what we do see is babies who do have a tongue tie or a lip tie or restriction, that they tend to tire really quickly because they're working really hard trying to get all the milk that they can, and they may fall asleep quickly after a short feed and wake a short time later for another feed to get the calories that they need. The babies also tend to get a lot of wind because they can't latch deeply, so they can't create a seal around with the lips around the breast and the nipple, or they may come on and off the breast a lot. Okay, but looking at these signs alone isn't a good indicator, as there can be other reasons for this, that these things happen, and some of these things can be sort of normal baby behaviour. That's why a thorough assessment is so important. Okay, so as I said, some babies will thrive to 8 to 12 weeks and other babies will not thrive from the word go. Okay. If you actually feel that your baby isn't latching deeply or feeding well, or you're is having difficulty taking bottles, Your first point of contact could be a midwife or a child health nurse. A lot of midwives and child health nurses are also lactation consultants, or they have vast feeding experience and experience in education about feeding. So the other person you could go to is a lactation consultant or your GP or paediatrician. If these people have the education, experience and time to go through with your breastfeeding history from birth and observe a breastfeed and perform an oral examination to determine whether there is a tongue or a lip tie, and advise you on the management regarding feeding and expressing until you decide on the plan that's best for you and your family moving forward. Okay, so that does take a lot of time, and I know that sometimes GPs and paediatricians don't have that time to spend with you. So just ensure that when you're talking to them, making the appointment, that they allow that time, okay? Or that you choose someone else. So if this sort of examination and history is taken shortly after birth, there is the potential for all these problems to be avoided. And that's certainly what we've seen happen in Brazil. The research about tongue ties first came out of Brazil when lots of babies were experiencing problems because they had undiagnosed tongue ties. And that's where the research started, probably about 5 or 6 years ago. So if all the aspects have been considered and you decide that you'd like more information or to consider having the tongue tie released, the most important thing to ensure is that you go to someone who's experienced in, like a health professional who's experienced in releasing these tongue ties and lip ties, okay? There are GPs and dentists who specialise in this. In some cases though, no treatment will be required, and the bottom line is it's your decision whether you actually have the tongue and lip tie released or not. Always ensure that the potential side effects of the procedure, the tongue and lip tie release, have been discussed with you. Although the complications are rare, it's your right to have all the information so that you can make a fully informed choice. So above all though, remember to go with your gut feeling. Remember that this is your internal guidance system and that no one else has this connection that you have with your baby. And so really hone in on that, okay? Sometimes we get a bit busy in our head and we're ignoring that little gut feeling that we have. So just be aware of that and follow it. Look, I'll put some pictures in the comments section below of what lip and tongue ties can look like. There are other ways they can look as well. And I'll put a video above this video as well. And please feel free to comment and tell me your thoughts and your feelings and your experiences if you've had a tongue tie and how it's worked for you. And have the most wonderful day, and I'll be back soon. Thanks so much. Bye.